Hello, my name is Nora Clark. Today I will be going over a teaching plan that I have put together on common GI drugs. First thing I would do to initiate teaching, I would have my students to read the chapter assignments in the book. I would give them a handout to review, to go over, so they would be more prepared for class. To start off class, I would start class off with a pre-test and let them have about 20 minutes to answer the questions, and then a little break. And during the break, I would grade the pre-test and kind of see what the students miss most, and kind of have that as my leeway for my class session. After the break, I would give the students a video to watch on common GI medications. Then I would go on with my lecture. My lecture would include, I would go over what the GI tract is. It consists of the mouth, esophagus, stomach, small and large intestines, the rectum, and anus. It's where the food enters the body and goes through the process and end with defecation. The function of the GI process is ingestion of food, secretion of mucus, water, and enzymes, mechanical and chemical digestion of food, absorption of the food, and of course elimination or defecation. During my lecture, I would also try to trigger the students to ask questions and prompt them to use critical thinking skills. Also, I would go over and let them know about the GI secretions in the stomach. They're produced by stimulation of food by eating, and the function is to dissolve the food and act as a bactericide against organisms that may be in the food. Okay. Just to briefly go over my little handout that I have with some common GI drugs that I have seen administered in practice, or I have administered myself in practice. Colace. It is a laxative or stool softener that is given to kind of help soften the stool for the patient and make the bowel movement easier. Side effects include bitter taste, bloating, cramping, irritation around the rectum. Doses are either oral or rectal, and it's 100 to 300 milligrams given daily. Sometimes I have seen it given more often if ordered by the physician. Special considerations about Colace is to consult a doctor if you have symptoms of constipation or any of those side effects that last longer than 2 weeks. And you don't want to use them if you have a bowel obstruction or if you haven't had a bowel movement. I would say, like in practice, we say 3 days, but I would say maybe even after a week, if I haven't had a bowel movement, we need to go see a doctor and see what's going on. As with all these medications, allergic reactions, if you have any kind of allergic reactions like shortness of breath, rash, fever, any kind of reaction to the drug, you want to stop using that drug and notify the doctor. Another drug that we use is a laxative. It's meclomagnesia. It's used for constipation or acid indigestion. Side effects include diarrhea, rash, itching, difficulty breathing, nausea, or vomiting. And it's given orally, either for constipation or indigestion. Doses are 400 milligrams per 5 milliliters, and it's usually 30 to 60 milligrams ordered daily. Or for indigestion, it can be 5 to 15 every 4 hours as needed. And with special consideration for meclomagnesia is to drink a full glass of water after having a dose of medication if you're using it for constipation. Protonix is a proton pump inhibitor. It's a medication that's used for erosive esophagus, with gastroesophageal disease. um, it's also used for a syndrome called Zollinger-Ellison syndrome. That's where you develop ulcers in your abdomen or in your abdominal, in the digestive tract. You can also be used for peptic ulcer disease. Some side effects include weight changes, nausea, vomiting, diarrhea, stomach pain, dizziness, fatigue, joint pain, and some doses. It can be given either oral or IV. And the oral tab is the form I've seen. It's an enteric-coated capsule that you do not crush. Yeah, and the IV, you want to dilute it in 10 milliliters of normal saline. And when you're giving it via IV push, you're going to give it over a rate of 2 minutes. Pepcid is a histamine H2 antagonist. It's given for duodenal ulcers, benign gastric ulcers, GERD, hypertension. Some side effects include constipation, diarrhea, nausea, vomiting. A lot of these GI medicines kind of have the same side effects, with the dizziness, diarrhea, nausea, and vomiting. Those are some common side effects. With Pepcid, it can be IV or oral, and it's 20 to 40 milligrams daily. And the same here with the IV push administration. You want to dilute it in 5 to 10 milliliters, and you want to give it over 2 minutes. And Pepcid can also be given pre-op to help neutralize the gastric secretions. Reglan is an antiemetic agent or prokinetic agent, and it's used for chemo-induced nausea and vomiting, diabetic gastroparesis, GERD, and it's also given pre-op to help with gastric emptying before any surgery procedure. Doses can be PO, IV, or IM, and it's usually 10 to 20 milligrams. And that dose, IV push, is also diluted in 5 to 10 milliliters of normal saline and given over 2 minutes. Another medication, Imodium, is an anti-diarrhea medication, and it's given for acute or chronic diarrhea. Doses are usually 4 milligrams initially, and you can follow it by 2 milligrams for diarrhea. You don't want to exceed 16 milligrams in a 24-hour period. Special consideration with Imodium, the diarrhea, you don't want to take it after taking a laxative, because you took the laxative to have bowel movement, and you don't want to use Imodium. It could have constipation properties. Phenergan is an antihistamine, first generation antiemetic. It is used for allergic syndromes, nausea and vomiting, motion sickness, and sedation. Some of the same side effects, but it also can have blurred vision, dry mouth, stuffy nose, ringing in the ears. The route can be by mouth, by rectum, IV, or IM, and it varies from 12.5 to 25 milligrams every 4 to 6 hours as needed. And for sedation, sometimes more is given depending at the doctor's discretion. Special consideration for Phenergan: you do not want to give it to children 2 years or younger. And when given via the IV route, it can be very toxic to the tissue, so you want to make sure that you dilute that medication in at least 10 milliliters of normal saline, and you want to push it slowly. Okay, and during the lecture, after talking about those Drugs, we will go over the indications, signs, and symptoms, administration of the GI medication, some of the special considerations with it, and some of the diagnostic tests that are used with GI include endoscopy, that can be esophagoscopy, gastroscopy, or colonoscopy. It's where they insert a tube and kind of visualize the digestive tract. You can also have a CT or MRI done to show more specific structures within the GI tract. And there's also stool studies that are done to detect microorganisms, blood in the stool, or even C. diff, or it's called Clostridium difficile. It's a C. diff. C. diff is usually a disease or infection that happens in the GI tract when a patient has been on antibiotics for a while. It can cause the good cells in the lining the antibiotic can kill the good cells in the GI lining and cause the C. diff. Some symptoms of C. diff include watery diarrhea, abdominal pain, loss of appetite, fever, blood in the stool, or even weight loss. Some special considerations when caring for a patient with C. diff. You need to make sure that you wear gloves when caring for your patients. And one special thing to remember is when caring for a patient with C. diff, you have to wash your hands with soap and warm water, because the spores that's in the C. diff is not killed with the germicide cleaner. And all surfaces that the patient come in contact with, it needs to be cleaned with a chlorine bleach-based product. Some treatments for C. diff include treatment with Flagyl and vancomycin, which is an anti-infective and antibiotics, and also probiotics, and you encourage fluids, or the patient will receive IV fluids. Some consideration for infants with the GI tract. Breast milk and formula in infants help to protect the GI from certain bacteria and help the enzymes to form in the body. And also solid foods are usually introduced about 4 to 6 months. And also some children do not agree with the formulas that they take, and sometimes they have to be switched to soy-based products. Some considerations for older adults: as they get older, they lose and have deterioration of their teeth. They lose a sense of taste and smell. They lose the production of the salivary glands, and they also have decreased gastric motility. Okay. After my class lecture, I will give students time to ask questions if needed, and we will work together and get those questions answered. I will give the students a post-test to kind of help see where they are with the class lecture, and I will also give them an evaluation of our class to see what we can improve on. I will also include a group activity with the case study and have the students to work together, and we come up with answers to help promote critical thinking. And at the end of my class, I will let my students know that the next class session will contain a quiz on the GI section, and I will also give them feedback from the evaluations. That's my presentation of common GI drugs and a little skeleton of how I would present to a class. I hope you enjoyed it. Thanks.